CBT, How to Manage Anxiety, Depression, and Fears Using Cognitive Behavioral Therapy. Written by Vince Sullivan. Narrated by James Land.
What is cognitive behavioral therapy? Cognitive behavioral intervention is one of many types of psychotherapy that works on feelings or perceptions that can cause a person distress. The method of psychotherapy also helps people with anxiety, depression, or mood disturbance. To gain this in a patient who may be suffering from depression, the online therapist will try to turn negative thoughts into positive thoughts. If a person has a phobia, the online counselor can make the patient imagine themselves in a situation that will help them cope with their fear. If a person has a mood disorder, then the therapist might find ways to encourage a change in the way the patient sees things and to see different situations. These are just a few vague examples, but hopefully the main idea is passed on. In simple terms, cognitive behavioral therapy is the process by which the professional will use different techniques, depending on the patient's problems, to change their thoughts and/or their behavior in a more positive way, so that the patient can function well in society without anxiety, disorder, or depression that slows them down. The evolution of cognitive behavioral therapy. So it is as well that in the eyes of the world it is dangerous to venture, and also why? Due to the fact that one may be shed. However, not to endeavor is intelligent, and yet not starting is making it very easy to shed that which it would certainly be difficult to shed in even the most adventurous endeavor, and also, in any case, never ever so quickly, so entirely, as if it were absolutely nothing, oneself. Cognitive behavioral therapy, CBT, has currently ended up being the dominant force in psychiatric therapy in much of the world, consisting of North America, the United Kingdom, a lot of Europe, and also progressively throughout Asia and Latin America. The surge of CBT results from the confluence of numerous aspects, primary among which is the boosted concentrate on evidence-based techniques, as well as associated calls for accountability in the distribution of behavior health services. Throughout its history, CBT has actually been committed to a clinical point of view to the study of psychopathology and also its treatment. Thousands of research studies have assessed various cognitive behavior concepts of psychopathology, and hundreds, even more, have actually analyzed the efficiency of CBT interventions. This scientific literary work has placed CBT in a one-of-a-kind position to dominate the field of psychiatric therapy. This extraordinary development promptly elevates the inquiry. What precisely is CBT? Does the term refer to a certain version of psychopathology or psychotherapy, or maybe to a domain name of treatment, either in terms of targeted procedures or pathologies? Actually, the term CBT has ended up being so broad as to resist clear definition. The website of the Association for Advancement of Behavioral as well as cognitive therapies, the premier multidisciplinary worldwide company dedicated to CBT, prevents a specific definition of the term, rather explaining the company's objective as the advancement of a scientific technique to the understanding and amelioration of issues of the human condition. The Miracle Morning. The Miracle Morning by Hill Elrod is a book for people who are excited to improve some aspects of their life, in particular health, happiness, love of life, finances, awareness, and spirituality. He tells us a daily morning routine to help improve and enhance our success. Miracle Morning makes it clear that in order to be successful, you have to devote time each day to personal growth, and then you have to make it 6 steps in the morning to create and shape that time. The purpose of the book is to save your mornings by doing something perfect at the start of them. The quotation I love the most from this book is, "Why is it happening?" That when a baby is born, we often refer to them as the miracle of life.
Sample complete. Ready to continue?